Hey guys, Dr. Ruth Robert, the creator of the original Crock Pet Diet, coming to you live today. And hope you all are having a good day and a good summer. It's getting brutally hot in Charleston and humid and all those things, so hope you're staying cool too. So upstairs today in our little home gym, and I'm very excited because next week I can start lifting again, which will be awesome. Recovering really well from surgery and just really enjoying the path back to health. So I had a question today from Joy. She's got an 8-week-old Havanese puppy. And so her question is how life-threatening are vaccines? And, and I hate hearing that. So let me give you a little background about vaccinations. Before dogs were routinely vaccinated in the 50s, distemper virus, which we rarely see today, would go through a town and kill all of the dogs. And same thing happened in the mid to late 70s when parvovirus showed up. That virus would just show up in town and just wipe out entire populations of dogs, which is just horrifying. And then if you think about Rabies virus, before there was a good and safe vaccine for that, similar situation. So these guys, the problem with vaccines is that they have been overused, both in the human and the veterinary setting. And the difficulty is that there's not been a real rational discussion about what's needed and what's not needed and when to start and that sort of stuff. And that's really where a lot of this is coming from. So for instance, in France, they've had an outbreak of measles. There have been 35 cases of measles in France. And the other, so that's kind of the thing, is that thankfully none of the children have been sick. But, for instance, with rubella or rheumatic fever, my uncle had that as a child. And he ended up developing severe congestive heart failure later in life, which is one of the sort of ongoing issues with that particular virus. So what I'd like to say first is there are always potential side effects with anything. And if you think through what's important, what your pet is exposed to, and what's likely to still show up, that's going to help you have a more intelligent conversation with your veterinarian. And your veterinarian may or may not agree with what you're saying, but I think it's important that you get the information that's needed to make a good decision. And so there's two sources for pets. One is the American Animal Hospital Association, or AAHA, produces a guideline of vaccination strategies, mostly towards dogs, but for cats as well. And then the AAFP, the American Association of Feline Practitioners, produces a guideline as well, and they update them every 2 or 3 years. More data becomes available. So in veterinary medicine, we had a wake-up call back in the early to mid-90s, and that was feline fibrosarcomas. We didn't know what was causing it, and granted, it was still a very small percentage of cats that was getting it, but initially it was thought that it was being caused by the vaccines. And so that happened just as Ron Schultz had published his first paper on vaccine immunology, showing that the duration of immunity for the core vaccines, distemper, parvo, and in cats, the upper respiratory viruses, probably was at least 3 to 5 years. And he has since repeated that work over the decades for every vaccine manufacturer, and found that really the duration of immunity is closer to 7 years, which he considers to be lifetime protection for most pets. Rabies virus is another story, and I'll kind of circle back to that in a minute. So that's very interesting. Duration of immunity is 7 years. If your pet has had a vaccine reaction, yes, it's not a good thing to repeat the vaccines, and because you don't want to tempt fate, particularly if it's already been a severe reaction. And so what I would say is, in that case, most conventional veterinarians want to either give your dog Benadryl or a steroid to prevent the reactions. But if you're giving your pet a steroid, you're also preventing the immune response that would allow your pet to develop antibodies to that vaccine. And so in my mind, that's just stupid. If you're suppressing the pet's immune system, and B, you're preventing the vaccine from doing its job. So in that case, it's frankly safer to not vaccinate. The other option that many people forget about are vaccine titers, and that's a blood test that's drawn to show if your pet still has protective antibodies to that vaccine or not. And so bear all of that stuff in mind, and I'm going to back up a second to Joy's question. She's got this 8-week-old puppy. She's not sure what to do. The breeder may or may not have told her that, the vaccines will kill her dog and all of this stuff. So here's kind of how I look at it. If for puppies and kittens, generally my recommendations were to do the first core vaccine at 12 weeks of age. And that's when we know that maternal antibodies have dropped low enough so that that puppy or kitten can actually respond to the vaccine and make its own set of antibodies. And then do rabies virus at 2 weeks after that, so 14 weeks of age roughly. And then at 16 weeks of age, do a final core vaccine. And so again, core for dogs is distemper and parvo. And for cats, it's the upper respiratory viruses, or the FVRCP vaccination. If you are in an area that's endemic with leptospirosis, it's not even recommended to start that series until after they've completed all the viral vaccines, yet commonly most veterinarians will give that in a combo vaccine. I do not recommend it because it's just not good. And hey Donna, and hey Lisa, good to see you guys. So the other thing I would say as well is that each time your pet receives a vaccine, in my practice, we always use Thuja, Thuja, which is a plant-based extract, post-vaccination to help prevent both short-term reactions and the more potential long-term reactions, especially in the case of rabies virus. So that's easy to find. If you're having trouble finding it, just email me at support@theoriginalcrockpetdiet.com. But you're going to use the herbal extract, and generally a drop per 10 pounds of body weight twice a day for 5 days post-vaccination really has done amazing stuff. It virtually eliminated vaccine reactions in the practice. And then the other kind of sticky question marks as far as post-vaccinal vaccine rabies behavior changes and things of that nature really eliminated that. And then more importantly with rabies, we see impact on thyroid function as well long term. So circling back around, so you've done the puppy vaccine series, presuming your dog or cat has had absolutely no reactions to the vaccines, then what? So at 16 months of age, which is roughly a year after they've finished the last vaccination, what I would then offer my clients is either boostering distemper parvo and rabies, and again separating those vaccines by at least 2 weeks and using Thuja after the vaccination is given, or considering titering for the distemper parvo vaccine. And I think at that age, you've got a 50-50 chance as to whether the titer will show protection or not. Because rabies is endemic in South Carolina, and actually in all 50 states for that matter, and because we do still see cases of rabies virus in both wildlife and our pets, and unfortunately in people, I do recommend boostering that vaccine at least once. And so what happens when you booster the vaccine at 16 months of age is that rabies vaccine is now good for 3 years. And the distemper parvo vaccine is now probably good for 3 to 5 years. And so at that point, we're definitely going to proceed only with titers for the distemper parvo or upper respiratory virus vaccine for cats every 3 to 5 years. And in fact, the AAHA recommendations are to do precisely that, but I think they suggest titering between 3 and 5 years based on the veterinarian's discretion. And again, that's a blood test. So often it is a bit more expensive than the actual vaccine itself, but you're also limiting potential risks from the vaccine. Now, having said all of that, if your puppy reacts to that first vaccine, and again, look for just distemper, just parvo, and maybe adenovirus, which is a type of herpes virus in dogs. And that's it in the vaccine. So no lepto, no coronavirus, no all this other stuff. Chances are good that if it's just those 2 to 3 antigens, that there will be no reaction. However, if it does have a vaccine reaction, that's when I would start titering. And it's really difficult because we're not sure if this puppy is going to be protected and how well it will be protected. And so that's when you have to start considering exposure risk. Like if you find that your puppy is not well protected, then that's not a great idea to take that puppy out to doggy daycare and all of this and that and the other. And having said that, most doggy daycares and boarding kennels will now accept titers as proof of vaccination, with the exception of the rabies virus one. So again, rabies virus, there's a 7-year challenge study that's been ongoing, and unfortunately at year 5, what Dr. Schultz found was that the titer level began to drop in dogs and cats as early as 4 years post-vaccination, and even more so at 5 years post-vaccination. What he did find is that these animals did have cell-mediated immunity, which is sort of the general immune system's response to rabies virus, but because it's unknown whether that is protective for rabies or not, we're still in this limbo land. He did get those animals into a USDA testing facility, which is what's required for rabies vaccine, or testing in this case for duration of immunity. But because the unvaccinated control animals did not have an 89% rate of sickness from the rabies virus, the test is considered invalid. And I think it was something stupid like 87%. So he's waiting to get back in to retest. So keep your eyes on that. Google the rabies challenge study for updates from Dr. Schultz and Dr. Jean Dodds as well. So I hope that makes some sense. And Wendy is asking the next thing I was going to say: how do you avoid getting rabies vaccine for cancer or cancer surviving pets? And this also applies to animals that have immunodeficiencies or autoimmune type diseases. And frankly, it's documented that these guys, that's where vaccination in general, not only rabies but also the core vaccines, are contraindicated because they do stimulate the immune system, and that's not a good thing when you're trying to keep it chilled out so it doesn't start missing cancer cells again, or for autoimmune disease, crank that disease back up. The interesting thing is that in the rabies compendium that was issued last year, and if you Google that, you can probably find this document, they are recognizing that that's an issue, and so they will allow titer testing and sort of a medical waiver, if you will. Again, this varies by state as to how well they've enacted or not enacted it. For instance, in Hawaii, they've been using titers for well over a decade because they don't have rabies virus on the island, and so they've been using that for helping pets immigrate to Hawaii, if you will. So they've got much more familiarity with it. But this is something, again, talk with your veterinarian, talk with your state Department of Health that controls rabies regulation. And often a medical waiver is acceptable. And especially if you've dealt with a veterinary oncologist, they're going to be happy to write that waiver for you as well. And internists are generally coming to the idea that, yeah, it's not so great to vaccinate a dog that's had autoimmune disease, especially if it's not well controlled. So that's kind of how you work it. In Charleston County, it's been a little bit more forward-thinking than a lot of counties in the rest of South Carolina and frankly in the country, in that if your pet bit somebody, and this is where typically this issue raises its head, that they would allow a 10-day at-home quarantine, and after that they would request that you revaccinate. The interesting thing in the compendium is that the rabies compendium, they said that any animal that has ever had a vaccine is considered to be current. And so at the discretion of the Department of Health, that's what's going to happen with a follow-up. So that's where titers become helpful. If your pet is not eligible for a vaccine, or it's got an illness or something of that nature, that's where having a titer available, showing that it does have what's considered to be protective levels of rabies antibody, is very helpful, because if the worst case scenario happens and your pet bites another person, whether it's some freak thing like it was injured and bit the person, or it's just wasn't really impressed with that person coming into your house, that's a great thing to have on hand as well. So Kansas State University is really the only place that is running these rabies titers test. If your veterinarian is a member of the American Holistic Veterinary Association, they are eligible to get discounts on the cost of the tests, which they can then pass on to you. It's still somewhat expensive because these samples have to be sent by FedEx overnight, and so that shipping alone is quite expensive. But if you've got an animal that is elderly, it's got some other chronic disease, it's had cancer, it's got an autoimmune disease, I would talk with your veterinarian sooner rather than later so that you can get this test done and kind of know what's going on there. In the event that these titer tests come up non-protective, then that's important to know too, and that may change what the response of the health department depending on what's going on. The other place where this becomes an issue is with boarding and things of that nature, and in that situation, if you've got a pet that's elderly, it's had cancer, it's got an autoimmune disease, find a pet sitter, because your pet's stress level is going to be so much lower if they're staying at home with somebody they already know, and do some trial runs, whether it's just hanging out for the day or go somewhere for a night. We could all use that break away from home every now and again to make sure that pet sitter is the right fit for you and for your pets. But set that up for them so they just don't have to deal with all the stress of going to a boarding kennel. Same idea too with your pet's chances of being exposed to other stuff like kennel cough and whatnot is much higher, and again canine flu, which is whatever it is right now. I think it's kind of quieted back down at the moment. So look for a pet sitter, get recommendations from friends, and from your veterinarian. Frankly, they can often recommend folks they've worked with before too. Now, and I just said kennel cough vaccine, and so I'm going to backtrack to Joy's puppy. The intranasal vaccine I do recommend for puppies, just because they're going to be out and about more. I really encourage pet owners to take puppies to basic obedience classes, things of that nature, not so much for the obedience, but just so that they learn how to socialize appropriately. The more you get that puppy out and about so that it can see what life is like, what other people is like, what different situations are like, that's so much better. So definitely look at that. And that's all I've got on vaccines. And Wendy's asking for an anti-inflammatory diet. is beef considered inflammatory in TCM? And can you give options for pairing meat for the crock pet diet here or in a blog post? I think it sort of trails off out of that. And here's what I'd say. So I think there's a lot of information about histamine releasing diets, and maybe that's where you're getting at, Wendy. I'm not sure. All of meats are considered to be histamine releasers. However, in beef, I can't consider that inflammatory in nature, other than the fact that if it's conventionally prepared beef, it's going to have a higher omega-6 ratio versus grass-fed or organic beef often has a much higher omega-3 fatty acid ratio. Omega-3s are the good guys. They are anti-inflammatory. Omega-6 are the bad guys. They are considered to be pro-inflammatory. So if you're like me, I'd love to tell you I feed all of our guys grass-fed beef, but frankly, it's all I can do to afford it for ourselves. So what we do with our guys is choose cuts that are leaner so that they have very low fat, and then trim fat off, and then add fat back in with a good healthy fat like coconut oil. And coconut oil, olive oil, grapeseed oil, all of those are great. Add those after the food has already kind of cooled down so you don't destroy the healthful properties of those oils. And so the crock pot cooking, slow cooking, I chose because it adds the least amount of heat energetically back into the food in a TCM or traditional Chinese medicine way of thinking. So again, I'm in South Carolina, it's hot, it's humid, the least amount of heat we can add into these guys' diets, probably the better. And so that's kind of it. And then what I would do is choose things that are low in inflammation in general. So by avoiding highly processed carbohydrates in particular, you've already got an extremely anti-inflammatory diet. Whole real foods is what's going to get you there. So I think that's tremendous. Now, be cognizant that your pet may have individual food allergies or more commonly food sensitivities. And especially if they've been eating something day in and day out forever and ever, that's when they can become sensitive to it if they've developed leaky gut syndrome. So that's a whole nother bag of wax. I did develop a gut health program some years ago that talks about this and about rotation and elimination diet, so that if your pet has leaky gut syndrome, there's some tools there to help you get it straightened out. Like I told you last time, I'm finding my way through SIBO, and so that's small intestinal bacterial overgrowth, which is just not very much fun. It's a common issue in dogs, and so the data out there in humans is that probably most people with inflammatory bowel syndrome or disease also have SIBO, and that may actually be their primary disease. So I'm in process of trying to do more research for dogs, and I've got about 3 hours a day where my brain works, so I just have to kind of take it as it goes. But that's something I'll be adding into that gut health program relatively shortly, at least a short monograph that will help you kind of guide your way through a specific carbohydrate diet. And Wendy, if you got a hard copy, I think you got the kidney diet one, and I apologize. We've had some issues with that. So 3 pounds of meat is correct for the original crock pet diet. 2 pounds is what we'll use for a lower protein diet like kidney or liver disease type diet when animals get to the point where they need that decrease. So that's what I've got for you guys today. Any questions I haven't answered, and thanks for jumping on, Donna, Lisa, good to see you guys, and Wendy, you as well. And if, Wendy, if that's not what you got, email Jenna at support at the original crock pet diet, and she'll send you an adjusted one. But great, and you've got the info, super. So guys, until next week, take good care of yourselves, take good care of your animals, and remember, your pet's best health starts in the bowl.